Good morning. This is David Henry. I'm the Communications Manager for the City of Amarillo. I want to welcome everyone to our weekly COVID-19 news conference. We do these every Wednesday at 11 a.m. Let me go ahead and briefly introduce who is on our panel today. We're joined by Amarillo Mayor Ginger Nelson, Casey Stoughton, Director of Public Health for the City of Amarillo, Dr. Scott Milton, Public Health Authority, Texas State University Health Sciences Center, Dr. Brian Weiss, Chief Medical Officer for Northwest Texas Hospital, Dr. Michael Lamontier, Chief Medical Officer for BSA, Dr. Rodney Gonzalez, Director of the Amarillo VA, and City Manager Jared Miller. What we'll do is we'll open it up to our some statements from our panel, and then we'll take questions from our media here in attendance. Let's go and start with Amarillo Mayor Ginger Nelson. Mayor, how are you this morning?
I am well, Dave. Thank you very much. Amarillo and the Texas Panhandle, our situation is getting critical with our COVID cases and the capacity of our hospitals. I've been hearing from citizens, emailing, calling. I've been hearing from our medical community in the same way, really pleading for help, pleading for us to do something differently that would slow the spread and decrease the demand for medical care in our hospital situations. Truly, they're crying out for help. Those are very difficult emails to read. They're very difficult phone calls to receive. And I have a tremendous amount of compassion for people who are working in our hospitals on the front lines in our medical field, and also for families who are separated from their loved ones who are sick, who have had to say goodbye to loved ones because they did not recover from the disease. We have a lot of people in our community who are suffering in this situation. I'm watching the numbers go up, and I'm seeing our trend. Our trend curve is one that's going up, increasing, and not slowing down. What's bad now will only be worse next week, and it'll be worse the week after that, unless we do something differently. I have some asks for you as members of our community, what to do differently in order to change the trend. Please wear a mask. The governor has ordered you to wear a mask, and I know all of us as good citizens recognize his authority over us. So whether you agree with it or you don't agree with it, we need you to wear a mask. We are asking that you avoid all social gathering. So kids need to go to school and businesses need to be open. And as long as we're wearing our masks, that can happen at an acceptable level of risk. But going to social gatherings like baby showers, birthday parties, even weddings, even funerals, these are adding to the risk and creating spread situations in our community that are stressing our hospital and stressing our medical staff. Please don't have any social gatherings. We're also asking that you would stay home if you're sick. So these are not new asks, but we need you to change the behavior that's happening in our city in order for us to change this trend, in order for us to relieve the pressure on our hospitals. And really, Amarilloans, these are easy things that we're asking. We may not like them, but they're easily done and they're temporary. We have had great news this week about vaccines, and we all have our eyes on that and our hope attached to when that's coming. It is coming in just a matter of months. So this is temporary, but please, we need you to follow what we're asking, what the CDC recommends to keep our city safe and to relieve the pressure on our hospitals. I want to speak about what's not quite as easy, and those are some decisions that are being made at the leadership level across our city. Many of you as leaders of different organizations, school districts, businesses, churches, nonprofits, volunteer organizations, you're having to make decisions that are very difficult. Decisions about canceling events that have been in the works and invested in already, and just in decisions about how to run your operations financially that are affected by canceling events, decisions about how to keep your membership together and connected and meeting each other's needs, even if you can't face to face be together. I recognize these are very challenging situations. And honestly, many of them involve options. There are no good and there are no easy options in making these decisions. But in responding to our medical situation here in the city and across the Panhandle, I'm asking you to have the courage to make difficult decisions, taking into consideration all the facts that you have. You're the only one who has all the facts about your organization. I'm trying, as the mayor, and these folks on the panel are trying to give you the facts about the medical situation so that you can make the best choice for your organization and also for our community. I want to speak just a moment about an ordinance that the city council will be considering in an especially called emergency meeting on Friday afternoon. The governor has issued a mask order in GA 29 that orders all people should wear a mask in public with few exceptions. There is an ordinance that we could pass that would tie our current situation to a health and safety code law that says you must operate your business in a manner that does not spread disease, that makes it safe for your customers to come in and do business with you. The ordinance would attach this COVID situation to that specific law that's already in place. And so it would allow our environmental health department staff to visit businesses and to assist them in enforcing the governor's mask order. And so it wouldn't mean that just people could come in wearing a mask, but they need to wear a mask the entire time they're in the store. And it would incentivize business owners to actually develop plans for their business where they can monitor and make sure that their customers aren't just doing the, yeah, I got one on to cross the threshold and taking it off while they're in the store, possibly exposing or being exposed by other customers. This is not an easy decision, and this is not something that we wish we didn't go looking for this. What we're trying to do is respond to the sincere and critical medical need in our community by putting in place solutions that would help to slow our numbers so that our doctors, our nurses, and all of our medical community could try to catch a break and try to stay on top of everyone that needs care. I welcome your feedback. The entire city council welcomes your feedback about this. And again, if you're to know the result of that meeting, that is set for 3 o'clock on Friday afternoon, and you can watch it on our YouTube page through the city's website at amarillo.gov. But obviously we'll be pushing out whatever that discussion and whether or not that ordinance city right now, Amarillo, they're under them for just a temporary period of time and get through what we need to do in order to help our medical community. That's all I have, Dave.
Thank you, Mayor. Let's now go to Casey Stoughton, Public Health Director for the City of Amarillo. Casey, how are you today?
Well, Dave, thank you. As of yesterday, there were a total of 19,529 cases of COVID-19 reported in Potter and Randall counties. 10,868 cases in Potter County and 8,661 cases in Randall County. We have a total of 12,761 recoveries, and we're glad about each and every recovery. We're up to 224 deaths reported in Potter and Randall counties, and we are certainly heartbroken at each and every death, and we're sad for each family. That leaves us with 6,548 active cases. Each of the cases do represent a unique individual. The total 7-day positivity average, it's a 7-day rolling 7-day positivity average for Potter and Randall counties is at 19%. The positivity rate at the drive-through testing site is at 48%, and the 5-day positive case average is 530 new cases per day. The public health drive-through testing site does remain operational, and individuals can still call 378-6300 to be screened and directed to the test site. This week, we've tested a record of 222 patients in one day. Our community remains at level red. Conditions remain consistent with level red as all indicators are being over that threshold for level red. Next week, we will reevaluate and issue a status level according to the indicators. GA 32's hospitalization rate for the 25 county Panhandle RAC region has been over 15% for 31 consecutive days now. Yesterday's percentage was over 35%, meaning that over 35% of the hospitalized patients in our hospitals have COVID-19. All 3 hospitals will describe the situations at their hospitals, giving us an idea of the number of patients they're taking care of, as well as the difficulties their staff continue to power through. They'll describe their how they're surging inside their hospitals to take care of patients beyond their capabilities, and how they are continuing to do that. I do want to draw attention to our hospitalization rate. The hospitalization rate is currently 5%, meaning that 5% of active COVID-19 patients are requiring hospitalization. With 530 new cases per day and a hospitalization rate of 5%, it doesn't take long to see that we as a community are continuing to stress our healthcare system. I don't want to lose sight of the crisis that's occurring in our community right now. Prevention of COVID-19 by wearing a mask, limiting social gatherings, staying home if you're positive or if you're exposed, good hand washing, all remain critical in the fight against COVID-19. This is truly an us versus it situation, and it's going to take all of us to win this fight. I do want, however, to talk about 2 hopeful things because I don't believe that hope is lost. Late last week, the CDC published information stating that masks not only protect those around you, but it also offers protection for the wearer, especially depending on the type of fabric, the number of layers, and how well the mask fits. So there's information at AmarilloAlerts.com describing this information. So if you have a mask that fits really well across your face, that's best. If you have a mask that's made of cotton fabric or some tightly woven fabric, that's best. If you have a mask that's 2 or 3 layers as opposed to 1 layer, that's best. Those masks will protect you as well as protect those around you. So now is the time to continue to wear your masks. The other great information, or the other great news, is that we have 2 vaccine companies who have shown very promising results during their phase 3 trials. They've shown over 90% efficacy, which means protection in their phase 3 trials. Our local health department, it has been working very closely with the Department of State Health Services with their distribution planning. And as those plans are developed and finalized, we stand ready here in Amarillo once those plans are finalized and the vaccines are ready to roll out. The vaccine will be distributed to in prioritized populations. And so we will be ready once those vaccines are ready and the distribution plans are ready to go. This is the time for us to finish strong. Even with a vaccine on the horizon, prevention efforts remain critical. We've got to continue to support our healthcare system by wearing a mask and taking care of all of those prevention efforts. And so I just want to leave us with that encouragement today. And that's all I have today, Dave.
Thank you, Casey. Now I'll go to Dr. Scott Milton, Public Health Authority, Texas State University Health Sciences Center. Dr. Milton, how are you today?
I'm fine, Dave. Thanks for having me. I have in my hand here, this is a petition with over 1,000 signatures of my nurses and physicians and colleagues that work at the hospitals and elsewhere who have signed a petition, and I have a letter from Dr. Dan Hendrick that I want to read. Dan is a nephrologist here in town, has practiced for years. He's the former chief of staff at BSA. He's the immediate past president of the Potter Randall County Medical Society, and he's currently the president of Amarillo Nephrology here in town. November 18th, 2020, dear Mayor Nelson and Amarillo City Council members, COVID-19 has created a public health disaster in our area. The hospitals are overrun such that the quality of care for COVID and non-COVID conditions have been negatively impacted. The general public continues to struggle with misguided principles and misinformation. Many are not wearing masks in public, which is contributing to the higher rate of virus transmission. Governor Abbott's executive order GA-29 has not been enforced in our area. Please consider an ordinance to enforce the executive order. In my opinion, this is best achieved by mandating that local businesses require employees and customers to wear masks. A penalty will likely be needed to encourage compliance. As a physician, I feel powerless to slow this pandemic. Education has failed to control the crisis. You as local leaders have the ability to make a difference. Enforcing the mask order will help. If we do so soon, we can reduce transmission, and hopefully the governor would not be forced to reduce business activity further. I started a petition with the above suggestions on November 14th, so that was just Saturday morning. And the petition currently has more than 1,000 signatures. That's from Dan. And I'm going to give this back to him, and I think he has plans to deliver it to Mayor Nelson and the city council later. So in summary, this is not really about personal freedom. We will not lose our democracy by wearing a mask. This is about responsibility. This is about personal hygiene. Think of this as toilet paper for the mouth. Think of that. We don't have a problem using toilet paper. We've had runs on toilet paper. So think of this as toilet paper for the mouth, because it's a very good analogy. It's about protecting your neighbors and your family and those most vulnerable, of which there are many. And we are proving that by watching what's happening to our hospitals. Mask will be the vehicle until we get to a vaccine, which will be coming soon. And this will be a huge step towards normalcy. And that's all I have, Dave.
Thank you, Dr. Milton. Let's now go to Dr. Brian Weiss, Chief Medical Officer for Northwest Texas Hospital. Brian, how are you this morning?
Well, Dave, good morning. I'm actually relieved because I had a bit of a scare this morning. So I woke up in the wee hours of this morning and realized I had a sore throat. Now, I know sore throats are not how COVID normally presents, but we also know that COVID plays by its own rules. Knowing that we have had 36 people lose their lives since the beginning of this month at Northwest Texas because of COVID-19, I can tell you my brain started into high drive. And you start asking those questions of, could this be COVID? What if I get very sick? What do I have to take care of before maybe I get very sick? And could I have given this to my family or other loved ones and maybe they get very sick? So recently I was talking to a colleague of mine and she just recovered from COVID, but she said during the height of her infection, several nights she laid up all night clutching her cell phone, not knowing if and when to call 911 because of the anxiety she was feeling due to the symptoms that she was having. Now, thankfully, she recovered from her infection only to tragically lose her mother to this virus a week later. This is the psychological effects of this virus, right? And I don't think we talk enough about it. I can tell you, I ran into the hospital and I swabbed myself this morning. And I probably deserve it, given all the swabs I've done to a bunch of other people. And I don't know what's causing my sore throat, but I do know it's not COVID-19. And I will tell you that the cup of coffee I had this morning was the best cup of coffee I've ever had because I could taste it. So, but think about if just having a sore throat made me go through all these mental gyrations, I cannot imagine, I hope I never have to imagine what our patients are going through lying alone in the hospital with COVID-19, hoping that every breath will be a little easier than the one they just had. And this is tragic. This is incredible anxiety that these patients are having to suffer. This is a cruel virus. And I want to use a rather morbid analogy, but our experience with COVID-19 is almost as if you were playing Russian roulette with a 6-shooter. 5 out of 6 people do fine, but 1 doesn't. Hey, and don't let you or your family be that one person. Please take care of yourselves. Do what you need to do to protect yourselves. Now, if we talk about the numbers in Northwest Texas, so we have almost 300 patients in the hospital on the acute side. That is well above what we are normally comfortable caring for on any given day. We have 128 positives in the hospital. Okay? 47 of those are in our ICU, with 20 of them on ventilators. Now, right now, we are at 26% COVID capacity if you use our total licensed beds, which we do from the governor's order. But we are actually at 44% of our acute care is COVID-19 right now, almost half. 1 out of 2 patients in the acute care have COVID-19. Now, we've talked a lot about what is the limiting factor of how we care for patients, and it's critical care. I know Dr. Lamentier, Dr. Gonzalez, and I all agree upon that. Critical care, so this morning, we had 6 patients in our ED waiting for critical care beds. We knew that this morning there were 25 patients out in the region waiting to be transferred in. 11 of those needed critical care beds. Now, the problem is you can't just set up critical care anywhere. Ventilators take special mounts and special basic wall adapters and special oxygen and gas supplies to be usable. So not any bed you can't use a ventilator with any bed. We also have special monitors in order to monitor these patients on ventilators. So again, we only have so many critical care beds, and we cannot just set up critical care beds anywhere because we don't have the wall adapters and sources for these ventilators. We have now 61 ventilators, largely thanks to the RAC. We can't use all 61 because we don't have the place to set them up to use them properly. So critical care remains the bottleneck. If it was just a matter of setting up beds, we could do that, but that's not the issue. It is the critical care beds and how sick these patients get. And it's also the critical care staff that's necessary to take care of these patients. That is the limiting factor. Right now, we have 2 full ICUs in the Northwest to take care of COVID patients. We have 3 med-surg units to take care of COVID patients. We are at 114% of our capacity in the hospital right now. So we have surged over our capacity, but again, critical care remains the problem. Outpatient testing, we had a 22% positivity rate yesterday. We always go somewhere between about 22% and 35% every day in terms of the number of tests we're doing. And then the one thing that's a real concern is we have 128 COVID patients. We have 129 staff quarantined today. We have more quarantine staff than we have COVID patients. And then we had 40 plus call-ins this morning of people who are feeling ill or are concerned. We are completely dependent on the nurses and now some of the physicians being supplied by the RAC. And the RAC has been invaluable to helping us. But this is a problem because we're having trouble maintaining our own staff. In terms of remdesivir, the drug we're using, we've treated 406 patients with remdesivir, most of them getting 5-day treatments. We have 41 patients actively on that medication. Now, there's a new medication coming, another antibody called bamlanivimab, or what we call BAM. Now, this is coming from Eli Lilly. This will be coming to us at some point in the next week. It is a monoclonal antibody like remdesivir, but it will be used for outpatients, right? And particularly outpatients who are at high risk for getting very sick from COVID-19. So we'll have more details as to how we'll be delivering that medication once we get it and set up that process. In terms of elective procedures, we continue to have plenty of PPE, but the concern once again is, do we have beds, particularly critical care beds, for people who are receiving surgery? So we have to, we're judging case by case to make sure that we can accommodate someone in a bed if they undergo a procedure at our hospital before we do it. And finally, up to this point, we have not had a single positive influenza test, but we know it is coming. All right. Please get your immunizations. The flu vaccine will protect you from that virus, and particularly the combination of flu and influenza, and COVID, which we know has been deadly already in the past. Yeah, that's all I have for this morning. Thank you.
Thank you, Dr. Weiss. Let's now go to Dr. Michael Lamentier, Chief Medical Officer for BSA. Dr. Lamentier, how are you today?
I'm good, David. Thank you for the introduction and letting me update everybody today on BSA's current status. I think a lot of what you've already heard today is really, again, some of that I'm going to repeat with the flavor of BSA and what we're experiencing. And I would say I completely agree with the comments that have been made thus far regarding the dire situation that we're in currently. Dr. Hendrick's letter that Dr. Milton read to you, I think was well spoken. Dr. Hendrick is a leader in our medical community and one of our medical executive committee members on our medical staff. You know, the stats at BSA are currently even more concerning than they are at Northwest in terms of numbers. And Dr. Weiss and I have been talking about this. We were at 200 admitted patients yesterday, which was a new peak for us at BSA. It's 200 confirmed COVID patients hospitalized. Remember where we were on October 1 at BSA, right around 50. Remember where we were on November 1, right around 150. And now here we are on November 18th and we're at 200. We're slightly lower than that today in the 190s. We had a couple discharges. We've had a couple more deaths. And that's how people are leaving the hospital. They're leaving either because they're dying or because they're getting discharged. And again, the number of people that are dying from this disease is significantly higher than any other infection we've seen in a while, to be perfectly honest. So we've got to take this seriously. We've got to be doing the things that we can do in the community, which is wearing a mask when you're out in public, helping to prevent the spread of illness to others. And that means if you yourself are healthy and younger and feel like you're going to be immune, you should not be kidding yourself that that's the case, because you have just as much of a risk of getting infected and infecting one of your loved ones as you yourself also, even in a healthy state, could potentially have a serious consequence. So please help us help you by doing the right thing with wearing your mask and social distancing. I think it's critical to point out a couple more stats before I get into a couple more points. We have 80% of our ventilators currently being utilized. That's after a dramatic expansion in the number of ventilators that we have at 60 ventilators. We're using about 40% of our high flow oxygen devices, which is a way to attempt to keep people off the ventilator. But just about 100% of the people we have right now in the ICU with COVID are on the vent, which is not good. We thought that number was looking better when we were in the late summer and early fall. And now those numbers are pushing higher toward those people that are in the ICU needing mechanical ventilation. And we all know that once you get on the ventilator with COVID, your prognosis is not good. Many of those patients never come off the ventilator, they die. So again, that's a situation where our critical care intensivists, our hospitalists, our Texas Tech doctors, all the physicians managing our inpatients are trying to do everything in their power to keep you off the ventilator. But when push comes to shove and you need to go on the vent, and in order to save your life, that's where we have to go. At this time, we have 36% of all the testing we're doing coming back positive. That is a significant uptick. That's for the month of November. That's a significant uptick from where we were. Remember, we were getting concerned about October's numbers being in the 20% of all tests coming back positive, in the mid-20s. Now we're at 36% of all tests that we're doing, both inpatient and outpatient, are coming back positive. Significant problem when we talk about community prevalence here in Amarillo. We're one of the hot spots on the map. Us, El Paso, the Lubbock area. That's for the entire state of Texas. When I reviewed numbers yesterday under the DSHS website, and you look at counties like Travis and Harris and Dallas County, their numbers of cases per 1,000 persons are less than half of ours. That's a big concern when it comes to why we, as a less populated area, are not having the success that they're having in terms of preventing cases in our community. That comes back to us as individuals, citizens of our community, doing the right thing. For those of you that are in the know in terms of what we've been doing in the hospital community, you all know how much we've been surging in terms of trying to create additional capacity. For those that think the hospitals aren't doing everything they can to expand, I hate to say that you are misinformed and misguided, but you are. Let me give you some of the facts. We currently have 87 ICU beds at BSA. Historically, our maximum number of ICU beds is 48. So we have added 39 new ICU beds, almost doubling, if you will, what we had in terms of ICU capacity, which comes with a whole series of events that had to happen. Number one, staffing, the nurses and physicians to cover that. And really, it's our physicians working extra constantly and continuously, our nurses doing the same, and then the RAC nurses. We would never be able to be at this level of volume of patients without that support from the RAC nurses. We're also getting some RAC physicians, as Dr. Weiss mentioned at Northwest. We're getting some of those as well. Huge help for us, but it's a small number. And again, it's an effort to give a temporary relief to our physicians who have been working constantly around the clock, day in and day out. We have had flu cases at BSA. We are only at 0.6% in terms of the positivity rate thus far. So we're not technically in a flu season until we get to 5% of our isolates. Here's the concerning part. we've had 3 patients that have already presented with co-infection with influenza B and COVID. So with a very small number of cases of flu so far, we already have evidence of co-infection, which we saw back in the spring, which we talked about. And we're nowhere near the peak of flu season at this time. So the concern there would be, obviously, as flu season starts to escalate over the next month or two, we're going to see more evidence of co-infection, greater evidence of the impact on patients that have comorbidities, the elderly, and what we fear is a higher mortality rate in those individuals who have co-infection. Again, this is scary stuff when we talk about population health and what we can do to protect the citizens in our community, especially those that are immunocompromised. We are also working with the state to attempt to get the monoclonal antibody that Dr. Weiss mentioned. It's got too many consonants in it to remember how to pronounce it. But the bottom line is that drug is not a wonder drug. It looks like, based on the statistics, there's a number needed to treat somewhere around 20 to 25, which means you'd have to treat 20 to 25 patients to prevent one hospitalization in someone who's higher risk. That is not a panacea, folks. It's a temporary stopgap, potentially, to hopefully help some people that have higher risk. I think we should be a little bit more excited, as Casey mentioned, about the vaccine, which so far there are 2 companies producing messenger RNA vaccines that look promising. But again, this is very early still. Phase 3 trials are done. As Mayor Nelson mentioned, hopefully in the next month or 2, we're going to be able to start administering vaccine. And it looks like Texas is one of the 4 states that's being targeted nationally to receive vaccine at the forefront of this distribution, which is good news. We at BSA are preparing to receive vaccine. We have the equipment, the sub-zero freezer capacity to store vaccine. We're also getting additional freezers purchased. And we've already submitted a plan of the hierarchy of who we'd offer vaccine to. And again, that is going to be critical, but that's going to take months. The goal here would be, and I'm sure you've read this, that over the next 3, 4, 6 months, we'd be able to roll out a vaccination program across the country that's going to start to have a significant impact. That's not going to help us in the immediate future based on the timing of when we're going to get that. So it just stresses what we need to do in terms of the right thing with masking, social distancing, and with this upcoming holiday, I can't stress enough that the potential to break the hospital's abilities to handle the patients if we're not doing the right thing is going to be exorbitant. And lastly, the only reason you're not seeing tents in the parking lots of the hospitals, and myself and Dr. Weiss and our CEOs of both of our hospitals have had these discussions. The only reason you're not seeing that is because we know that we're doing a better job of treating patients in the walls of the hospital as opposed to out in the parking lot where we can't do an adequate ICU level of care, which is what many of these patients need. So please don't be misguided by not seeing those types of structures. We really could have put those up a month ago, but we're trying to do the right thing for our citizens and caring for them in the best infrastructure possible. I think that's all I wanted to add today. Thank you.
Thank you, Dr. Lamentier. Let's now go to Dr. Rodney Gonzalez, Director of the MRA. Dr. Gonzalez, how are you?
I'm doing well, David. Thank you. So good morning, and thank you again for the opportunity to speak to our veterans in the Texas Panhandle. As of this morning, our healthcare system is caring for 18 COVID-19 positive patients in our hospital, 11 of which are in the ICU. In addition, the VA's 4th mission, as codified in law, states the VA will use its vast infrastructure and resources, geographic reach, deployable assets, and healthcare expertise to make significant contributions to the federal emergency response effort in times of emergency and disaster. And so the Amarillo VA is currently treating 6 non-veteran included in our numbers mentioned previously, both critical and non-critical community patients to help Texas Panhandle in response to the request the VA received from FEMA. We at the Amarillo VA are proud to assist the Texas Panhandle in the fight against this pandemic while we continue our primary mission of caring for our nation's veterans. As a community, we're working together to navigate the changing landscape during the pandemic and help when we have the opportunity. Our Amarillo VA staff have thrived during the most demanding of times and are well positioned to take these patients in and help them. Working together to fight this pandemic will only strengthen our community's ability to curb this pandemic as we stand ready to support our Texas Panhandle neighbors during these challenging times. Because these are challenging times, I do want to reinforce what our fellow panelists have reminded the community. It does take an army, and I don't say that because I'm an Army veteran. What I mean is it takes every single one of us to win our fight against COVID-19. Therefore, I want to reiterate the importance of taking those simple steps to be part of that army that will fight and win this fight. Wear your mask or face covering, practice social distancing, exercise good hand hygiene. Now, in addition to those steps, I do want to remind, stay home if you are ill and get your influenza vaccine. Dr. Lamentier just talked about, but while getting your influenza vaccine doesn't prevent COVID, it does help keep us out of the hospital and open up those hospital beds for ill patients who need the care. I also want to remind veterans that while these COVID numbers are high, they do have the opportunity to see their care provider through video or telephone appointments. And so please call the VA and discuss that if you would like to consider it. The VA continues to offer both symptomatic and asymptomatic testing for COVID-19 free to our veterans. And for veterans who might be interested, please call their primary care team to discuss options. We do offer collecting this testing at all of our clinic locations. Finally, I'd like to point out tomorrow is the Great American Smokeout. So if any of our veterans are struggling with nicotine addiction, I would encourage them to consider tomorrow as an opportunity to quit nicotine for good. Our health providers have nicotine cessation programs available by simply calling us to set those up. As always, I want to extend my appreciation to all of our staff at the Thomas E. Creek VA Medical Center and our community-based clinics for continued effort to ensure veterans get the health services they deserve. And I'd like to thank the City of Amarillo for giving me the opportunity to speak to my fellow veterans. May God bless each one of you.
Thank you, Dr. Gonzalez. Let's now go to City Manager Jared Miller. Jared, how are you today?
I'm good. Thank you, Dave. I wanted to touch on something that we normally hit at the very start of the meetings. Why are we wearing face masks, face coverings when we're in our offices by ourselves? Right now, what we're doing, and as every single one of the medical professionals who really know what they're talking about have said, one of the best ways that we can slow the spread of coronavirus is through wearing our face coverings. So the reason we're wearing the face coverings, even though we don't need to in our offices by ourselves, is we were trying to highlight the need. We want people, we want it to be up front in everyone's mind while we're going through this press conference that face coverings are important. So that's why we're wearing them. I've gotten a couple of questions during the press conference asking me to, why are we wearing face masks? I've also gotten a number of emails during this press conference and have responded from people on both sides of this issue. And I've responded to them, asking them to give me a call. I'd love to have a conversation with them so that we can walk through this in a rational and common sense way. The city is still offering drive-through testing. If you feel like you have symptoms consistent with coronavirus, you'll call our public health hotline at 378-6300. You'll be screened for the drive-through testing center. That drive-through testing center is busy. It's moving people through there very quickly and efficiently. You will not wait a long time. And if you feel like you have symptoms and want to get tested, we will help you out as quickly as possible. If you don't have transportation, you have been screened by the drive-through testing center and have been referred for a test, call our Amarillo City Transit at 378-3095, 378-3095, and they'll schedule and arrange transportation for you to the testing center and from, so that you can get tested. We don't want transportation to be a barrier to people being able to get tested for coronavirus. The governor has a number of executive orders that are in effect right now. Governor's Executive Order GA-29 refers to face coverings. Every person shall wear a face covering over the nose and mouth when inside a commercial entity or other building or space open to the public, or when in an outdoor space wherever it's not feasible to maintain 6 feet of social distancing from another person not in the same household. There's a few exceptions to this, but in large part, and for almost every situation out there, there's very few people that would fall into those exceptions. Please be wearing your face coverings when you are in those situations. We're going to talk about that a little bit more in just a moment, and we'll also, I'm sure, answer questions regarding it. Another executive order is GA-32. GA 32 is the governor's executive order, the primary governor's executive order that stipulates how things are going to be operating in the city of Amarillo and in Trauma Service Area 1 right now in our 25 county area. As an area of high hospitalization, and the doctors in Casey have gone over just how high a hospitalization area we are, but as an area of high hospitalization, we can have 100% occupancy in our essential and critical infrastructure facilities, our religious services, local government operations, child care services, youth camps, public and private schools, and a number of service areas that maintain 6 feet of social distance, like beauty salons, cosmetology salons, barbershops, nail salons, etc. In all other situations, our businesses are limited to 50% capacity. With one exception, bars are required to be closed during a period of high hospitalization that we are currently in. We will not move out of the classification of high hospitalization until 7 consecutive days of less than 15% hospitalization rate in the governor's executive order. In response to these exceptionally high hospitalization rates that we're currently experiencing, the lack of hospital space that we currently and the extremely high number of positive coronavirus cases that we currently have in our community, the city has modified our service delivery plans. We have done those modifications to reduce and restrict face-to-face interactions. We're still allowing them under controlled circumstances and with appointments. Most of the services on all of our outward-facing departments that interact with the public, have modifications to how they're delivering services, although all services are still being delivered. For example, at our utility billing department inside City Hall, we're providing those services curbside or virtually or online or through the phone, over the phone. Same is true with our library services, animal management services, et cetera. And that goes on through all of our different departments. If you have any questions, or if the press has any questions on some of the specifics with any one of those departments, I'd be more than happy to answer those questions. As the mayor mentioned earlier, we're also looking at an ordinance that would be passed, or that would be considered on Friday. That ordinance would just make clear through city ordinance what's already available to us through state statute, through the Texas Health and Safety Code, section 341.011, paragraph 12. And that deals with nuisances that create conditions where it's possible or likely disease, and in this case, coronavirus is classified as a disease by the Texas statute as a communicable disease. But that ordinance would allow the city, would make clear through city ordinance what's already allowed through state statute for us to be able to enforce situations that create the possibility or likelihood of transmission of a communicable disease, in this case coronavirus, from person to person. Those conditions would include not wearing face coverings when within 6 feet of individuals, not wearing face coverings when in groups, gatherings of more than 10 people inside businesses, not employees not washing hands on a frequent basis, not sanitizing frequent touch surfaces. The purpose of the ordinance is not to enforce and issue citations. The purpose of the ordinance is compliance with the governor's order on face coverings. I think it's clear, if we trust any of the things that any of these medical experts on here have said, and we have some of the leading experts, epidemiology, hospital treatment, patient care, all these different things on this call right now, and they're taking their information, most respected leaders across the world. But it's very clear that if we trust what they're saying, one of the easiest things that we can do, and one of the most effective things that we can do, is wear our face coverings. So this ordinance will provide what's necessary for our business owners to be able to take the steps they can with their patrons to, one, make sure that we're not increasing the spread of coronavirus, but two, to keep their patrons safe. We are coming up into a period of time where we're going to have a lot of shopping. There's a lot of things that we're going to want to do that's going to cause us to go out to our different businesses, both retail, service providers, all kinds of businesses. We want to make sure that we can make it through this holiday season and move the needle in the right direction, rather than having happen what a number of experts are throwing out there as a very high-risk period of time, which would result in acceleration of our positivity rates and the possible overwhelming of our hospitals. And we're right on the cusp of that right now. So the purpose of this is not to enforce, but to achieve compliance so that we can reduce the spread of coronavirus in our area. That's all I have, Dave. If there's any questions, I'd love to answer them.
Thank you, Jared. Let's now go to our members of our media who are in attendance and allow them to, if you have a question for an individual panel member or the panel as a whole, that's perfectly fine. Let's start with, if I'm not mistaken, Kevin Welch of KFDA News Channel 10. Kevin, how are you today?
I'm good, Dave. Thank you. Jared, can you give a couple of examples of other Texas cities that are using the health law to use businesses for enforcement?
Absolutely. Well, any city can do it because it's already in the Texas Health and Safety Code. So I don't know how many are doing that. I know, for example, right now we're looking at it, as is the city of Lubbock and a number of other cities in high hospitalization areas. I know that as far as large cities, the only ones that I know of that are doing it, and they received a letter of support from Governor Abbott, is the city of Austin, the city of San Antonio. Now they're doing it, and they're not in the dire circumstances situation that we're in. So in their case, it was preemptive. In our case, it's reactive. So those are the cities I know of. Although a number of cities that I'm talking to on city manager groups that I participate in are looking at the same ordinance that we're looking at.
I had a call from the mayor of Odessa this morning. They're looking at it. It's been interesting. You know, this is a hard place to be as a leader. And so, you know, this week I have visited with the mayors from Fort Worth, Lubbock, Clovis, Odessa, Wichita Falls. Just we're trying to figure out, is there a good way? Is there something that's working in these communities that can help relieve the hospital pressure and frankly, the death curve? So I appreciate that question. And certainly if someone comes up with the right idea, please pass all ideas toward us. We want to hear them. We're searching for them.
And I think it's important to note that we're going to be responding to calls for service in this regard. We have between 3,000 and 4,000 businesses operating inside our 2-county area. And this would be something that applies not just inside the city of Amarillo, but because we contract with both Randall County and Potter County to provide environmental health and public health services. We would also be working through the entire public health district to encourage compliance. But bear in mind that we have between 3,000 and 4,000 businesses and 9 environmental health officers. So it's going to be limited as to how many businesses we will be able to interact with. But we will be responding where we get calls requesting service, where we have complaints of significant non-compliance with the governor's orders.
Okay. And I guess, Casey, have you been seeing through test results any kind of indication of what's going on with nursing home testing?
Still just, you know, they're required to test their employees and their residents. And so we see positives occasionally, and we see negatives as well. So just kind of that, you know, continual testing. We see positives and are working with those facilities.
Okay. And with the new occupancy restrictions for restaurants, how's compliance and enforcement going? I guess, Jared.
I've not heard a lot of complaints about restaurants. You know, it's one of those unique situations where you wear the mask when you enter. You wear the mask if you leave your table to go to the restroom or something like that. But when you're at the table, you're not wearing your mask. So for the most part, many people inside restaurants are not wearing their masks now, or their face coverings. Now, we do get some complaints about employees and staff not wearing their face coverings when they're serving tables and things like that. So we do go out and interact with them. To my knowledge, we've not gone out and had anybody refuse to comply.
And I guess, Dr. Milton, who is responsible for the planning and actual distribution in our region of the vaccine?
Well, I think that's going to be a coordinated effort between everyone. So we'll certainly help with trying to get that coordinated, but there are different providers as well that could be receiving the vaccine. You know, a lot of this has to do with the capacity to store the vaccine. These vaccines have to be stored at negative 80 degrees. I think one of them has to be at negative 80 degrees centigrade. So you have to have the right equipment to have that. And then be able to store it and then dispense it later. So that'll be a coordinated effort.
I'd like to add to
Go ahead.
that. The city has a very detailed communication plan that's been put in place. We haven't executed on it yet because we don't have all the details regarding which vaccines are going to be available, what their, as Dr. Milton was saying, what their storage requirements are, what their dosage requirements are. Some of them have to be stored as low as minus 70 degrees Celsius, and some of them require 2 dosages. They're not interchangeable. So if you start with one vaccine, you'd have to, and it requires 2 doses, you'd have to get the second vaccine of the same dosage at the required interval. Some require 3 weeks interval between the 2 doses. There's a lot of different variables there, but we do, through the Texas Department of State Health Services and through the CDC, they will be providing phasing plans, prioritization plans for who doses of vaccines when the availability is low, and then as which categories of individuals are going to roll in next. So, you know, your essential care providers, your people with high risk, you know, things like that. As we roll into more capacity, we start rolling in more categories of citizens into availability for the vaccines. So we will be communicating that as soon as we have more information about which vaccines, what their requirements are, and as we finalize the plans with Department of State Health Services and CDC on those prioritizations and rollout schedules.
Okay. And I one more question for whoever wants to answer it. Given our current hospitalization trends and just general positive test trends, is there anything out there that's going to get us unstuck and get us going down?
I'd say it's everything we've talked about. It's got to be just the basic measures that we know work against this virus. The facial coverings, distancing, yeah, that's it. Right now, it's the only tools we have until some of these immunizations and other things surface that may make a difference.
I've heard more than one person say to me, Kevin, well, why should my church not meet? Or why should I cancel my business meeting when schools are still meeting, when other people aren't canceling? And I recognize the challenge there. But you have the power as an individual to make decisions that will start the momentum, that as those decisions come together in our community and other people who you may not even know you influence, they're watching you, they're watching your decisions, you're having an impact in our community. And that kind of impact will eventually come together for a citywide, community-wide impact. And that's what's going to generate the change. So if you want to know what is it that needs to change, it's me and it's you. It's our individual decisions using our influence and our leadership in the community. We do what we know is right, what we feel convicted to do in answer to what our medical authorities are asking us to do. And we don't look at what other people are doing. We don't say, well, they're not canceling, so I don't think it's going to make a difference if I cancel or not. That is very dangerous thinking. Somebody has to stand up and be the first one to say, I'm going to have the courage to make a change, and I'm going to be the leader for the rest of you guys. You'll see it's making a difference.
Okay, thank you, everybody.
Thank you, Kevin. Let's now go to Roger Gray of KVI Channel 7. Roger, how are you today?
I'm good. Thank you, guys. Can we just dive a little deeper into the whole vaccine thing? It's like Pfizer May 1st for the emergency use authorization by December. The Moderna vaccine, unlike Pfizer, does not require the cold storage. It's you can store a refrigerator. My guess is that's going to be the easier vaccine for a lot of particularly practitioners. But regarding distribution, has the city heard, if I could maybe go into a little more detail, Jared, has the city heard the feds, the state about distribution, activating the National Guard, for example? I know the Army is going to be in charge of what is being called Operation Warp Speed. Have you guys heard from the governor yet about when this thing is going to hit the ground, what the plans are?
Department of State Health Services has a plan out right now. I think it's available to anybody that goes to their webpage. Pardon me, a little easier to understand. But phase 1 and 2, well, phase 1 especially, takes place in November, December, January. That's when they're projecting vaccines to begin becoming available. They're expecting those to be extremely low availability at those times because production will not have ramped up significantly. They're not aggressively producing any of these vaccines right now because none of them have been approved. Dr. Milton and any of the doctors on the show correct me when I get into something that's not my bailiwick. But as far as their plans go, once we get into phase 2 and we have increased numbers of vaccine doses available, that these schedules match what these estimated timelines are. And again, right now they are very estimated. That would be somewhere between January of 2021 and July of 2021. We're still going to have an emphasis on ensuring access for members of phase 1 critical populations. And I kind of alluded to what those populations were earlier. But Texas is going to use specialized vaccine teams as needed to vaccinate certain groups lacking access to the vaccine. They will be using personnel to do it. I don't know exactly what personnel that's going to be. Say that they're going to use military forces. It just says they're going to use specialized vaccine teams. So I think that's yet to be determined at this point.
So the triage plan is for the most vulnerable, older folks with pre-existing conditions, et cetera, would be the first to get it.
Well, the first to get it's going to be those essential for treating.
Mm-hmm.
So essential critical personnel on the healthcare side. But outside of that, yes, they're going to start rolling in vulnerable populations and then additional less critical but still essential services personnel. So there's going to be a balance of critical vulnerable populations and essential populations that start getting rolled into the mix at that point.
If I could ask the doctors, we mentioned the Pfizer vaccine. I think Dr. Lantier may have answered part of this question. The transportation and storage of the Pfizer vaccine seems to be very particular, and I gather very expensive. Are we ready for that? Does everybody have the equipment to store and keep and transport the vaccine?
Yes, I can finish up that commentary I made. And yes, we have the current capability to store the vaccine. We're also being told that the vaccine, when it comes, will be packaged in appropriate special containers that the pharmaceutical company has crafted, packed with dry ice. And that has a certain period of time that it can be kept in those containers. But we also have the freezer capability. And we're also, as I mentioned, purchasing additional space to accommodate more vaccine as needed. So it is a little bit more meticulous, but I do not think that it's insurmountable in terms of being able to receive and administer that vaccine.
And I know, go ahead, I'm sorry.
Oh, sorry. I asked Dr. Lementier to check, but the Moderna and the Pfizer are both messenger RNA vaccines. And the thing is messenger RNA, it can be easily degraded by these proteins called RNases that are everywhere. That's why these vaccines have to be stored at such a low temperature, is to stop proteins like RNases from breaking down the vaccine. My understanding is that the Moderna needs to be stored at -40, not quite -70, but it's not a refrigerator. It still needs to be frozen because of that. I think some of what we're hearing, which is a little concerning, is obviously what Dr. Lementier talked about is just the storage. We're also being told that the vial needs to be thawed, that the vaccine resuspended and injected immediately into an individual. So it's not like you can suspend 1,000 vials one morning knowing that you're going to inoculate 1,000 people. So it's that process of every patient going through that step of resuspension. And then we've been informed that, especially for the Pfizer vaccine, that you then have to monitor the patient for an hour after the vaccine with acute 15-minute vital signs. So vital signs every 15 minutes. That is a logistical nightmare. Now that may change as these come out and we get more experience with it, but that's part of our planning, is how are we going to possibly get this done to any great extent, knowing these are the logistics we have to do, at least with the Pfizer vaccine at this point.
Okay, I think that answers my questions. Thank you, guys.
I would also add that Texas Tech is going to be able to have several thousand doses of vaccine available because we have the refrigeration capacity here too.
Well, one last thing then, for a private practitioner, I gather this technology is pretty darned expensive. The Sub-Zero.
Yes, I mean, certainly I know at Northwest, we have bought several freezers in anticipation of this, -70 freezers, because my understanding is that one of the challenges is how to transport this safely in trucks that don't have the ability to go to -70. So as Dr. Lamontier is saying, there's all kinds of packaging considerations, but yeah, certainly we have purchased more freezers in anticipation of this requirement.
Okay, thank you, guys.
Thank you, Roger. Let's now go to Aaron Langston at KAMR Channel 4. Aaron, how are you?
Pretty good. How are y'all?
Good.
First question is, Dr. Lamontier mentioned a while ago that BSA is doing all they can to avoid being outside the hospital walls for treatment. But how close are we to being forced to do just that?
Well, I'll start to expand. As I mentioned, we nearly doubled our historical ICU capacity by adding 39 beds. We also added 77 new med-surg beds, which are non-ICU beds. So again, that's over 100 new beds, if you will, that we expanded within the walls of our hospital in an attempt to prevent doing that and prevent going outside of the walls. We have the ability to go, and we're currently the past week and a half, yesterday, the day before, with our surge teams and our facilities folks, we are planning to expand further med-surg beds with negative pressure. Again, one of the key pieces that we need to do to be able to house a COVID patient and go beyond where we are even now with additional beds within the walls. However, we are at the maximal capacity of what we can do for intensive care services. So looking at other options for ICU care becomes an extreme degradation in terms of the quality of equipment and supplies and staffing that we can provide, just because we're spreading things too thin with staffing. We would need an additional increment of rack nurses well above and beyond where we are. And I told you we had 150, maybe I didn't say that, but 150 rack nurses here as of yesterday. That's a combination of licensed and non-licensed. And again, this is a scenario where we need other things: physiologic monitoring, additional ventilators. There are things that we would need to do above and beyond this that we can't get in a day or two.
Yeah, but I agree with everything Dr. Lamontier said. I think, we have at Northwest, we've purchased over 100 new beds, exactly with the purpose of doubling up some of the med-surg floors. But again, that's the easy part. The hard part and the challenge is critical care. And we're in the same boat. And when we look at things like some of these tent structures that have been offered to us, they just are inadequate to provide critical care. They're not going to solve our problem. So, right now we're looking at some of our post-surgery recovery areas, which some of those areas do have the outlets for ventilators. Again, can we buy a few more critical care beds there? But we're very limited at this point in that capacity.
All righty, thank you very much. And it's been asked a few times on previous calls here concerning schools and school closure. And y'all have said that it is not anyone here's decision to make that, or job to make that decision for the school. Well, last week the school has come out and said it's the city's decision. So if it's not yours and they aren't claiming it's theirs, do we know who has that authority to make that decision?
Yeah, the people that have the authority to decide whether or not a school is open or closed is the school. The governor has authorized them to remain open at 100%, but is not directed. So those are decisions that are made by each individual school district. I am sure that you misunderstood what they were saying, because the city doesn't have the ability to issue directives that are in contradiction of the governor's order. GA32, Executive Order GA32 is very clear that schools can operate at 100% as long as they're adhering to the minimum standards put forth in the governor's checklists for opening Texas. And I think it's important, as we're talking about ordinances and what things can be open, that we put out the website where you can find those checklists, and that's at open.texas.gov. Go to that page and you'll be able to find all the different checklists for schools, for retailers, restaurants, parks, office-based employers, museums, movie theaters, manufacturers, all the different categories of places where people might go. Gyms and exercise facilities, all of those things are included. It makes very clear what the patron's responsibility is and what the business operator's responsibility is as far as face covering, sanitation, distancing, all of those different things that we've been talking about as essential and critical methods of reducing the spread of coronavirus.
Okay. Do we know how many bodies are having to be stored in the trailers that were brought in over the past 2 weeks right now?
No, I don't.
Okay. And last question. With the school district having the highest number of reported cases in the state of any school district, the hospitals being maxed out, like I said, we're having to store bodies in trailers to accommodate just the need. At what point do we need to lobby the governor for more restrictions and more resources beyond just medical staffing?
I'll jump in. The governor's orders have provided the tools necessary and the direction and guidance necessary, both through the executive orders and through the checklists. I think it's very clear if we look at some of the results that we've seen in other jurisdictions where they are more adherent to the governor's orders. They do have lower incidents of hospitalization rates, fatalities, all these different things. They're all correlated with your hospitalization rate. Your hospitalization rate is driven by your compliance with the face covering requirements. Again, if you believe the things that are being told by our medical professionals, and I for one do. Far be it from me to disagree based on my wealth of medical experience. Sorry, that's a little sarcastic, but we have some of the preeminent experts in these fields telling us what we can do. So the governor's order has already given us the tools necessary to make these decisions and to be able to have positive effects. So it's really on us to adhere to those so that we can see those benefits.
Okay, that'll work. Thank you very much.
Thank you, Aaron. Let's now go to David Gay on the Amarillo Globe News. David, how are you today?
I'm good. Good afternoon, everybody. First of all, for the doctors and on the call, can you talk to me a little bit about the differences between this new treatment that I'm not going to butcher, BAM, and as well as the remdesivir treatment?
The first one that you mentioned, BAM, is a monoclonal antibody. So it's designed and it's going to be intended for individuals prior to being admitted to the hospital in order to try to prevent an admission to the hospital. It's an infusion. I think it takes about an hour to infuse. And so that's the strategy for that. Remdesivir is an antiviral medicine. It directly interacts with kind of the architecture of the viral structure to stop replication. And so those are the differences. Now, remdesivir is only given intravenously. And so people have to be essentially in a hospital setting to get that. We typically give that for a 5-day course of treatment, as Dr. Weiss and Dr. Lamentier have talked about. So essentially remdesivir is more for people that have been hospitalized. And then the BAM therapy is the strategy will be to try to prevent people from being hospitalized.
And on that, is there any more word from the state about when that treatment will be available here in Amarillo and how much each hospital is receiving?
Well, as Dr. Weiss mentioned, it looks, and Dr. Lametier's also mentioned, it looks like it's going to be relatively soon. I would think within a matter of days. I know that we've been meeting and discussing about that. I was talking with our pharmacist this morning about that over at the hospital. So I think it's soon.
Absolutely, absolutely. And I guess the last question that I have is, as we are all well aware, next week is Thanksgiving, and which kind of serves as one of the starts of the holiday season. And some people are going to be traveling. With the mayor of Houston tweeting yesterday, I'm reading here. I encourage you to avoid going into areas with high community spread, like West Texas. So, can you tell me, I guess, for everybody on the call? I mean, what are your thoughts about individuals traveling next week, participating in Thanksgiving festivities with families in the midst of this ongoing COVID-19 situation here in the Panhandle?
David, I just say we got to realize that those are opportunities for us to spread this virus to all of our loved ones, and especially elderly members of family or members of family who have comorbidities and chronic illnesses. I just think I can't imagine anyone would be comfortable with themselves knowing that they may have given that virus to a loved one that ultimately leads to their death or severe illness. So I leave it to every person's individual decisions, but it's very real. I think it's a very vulnerable time right now, and we've just got to be as careful as we can be to protect our loved ones.
Yeah, I would agree with Dr. Weiss. It's honestly best not to travel. The way I look at my Thanksgiving is I will be spending it with very few people, probably just me and my wife, and we will be YouTubing our kids and talking to them from a distance.
Dude, this is Dr. Gonzalez. I'll say I'm new to Amarillo, and both my family, my parents, and my wife's parents were planning on coming this Thanksgiving to enjoy it together. And they have both, my parents from California, my wife's parents from Missouri, have decided we are not going to come together. So it's just going to be myself, my wife, and our 2 children. My son, who's stationed in El Paso, is not getting up here for Thanksgiving, and that's what we are doing as a family.
I think you'd get the same answer from just about everybody on here. My folks were going to be coming into town from out of town for Thanksgiving. Extended family was planning to come to town for Christmas. We've canceled modified those plans to visit virtually and to do gift openings and dinners and things like that virtually. And it's a little bit like the fire in the TV that you see on It's a Wonderful Life. But it's still going to be Christmas. It's still going to be Thanksgiving. And we do need to take responsible steps to safeguard our family.
So with those, I guess, approaches to Thanksgiving, would that be, I guess, your recommendation to the community for them to take those steps and approach it in that way, other than the normal gathering for the holiday in a normal year?
Yes, absolutely. I would recommend those things.
Yep, I concur, absolutely.
And I think that we should also add, we know that not everybody's going to do that. So if you do meet with your family in a group, please utilize all the prevention and safety measures at your disposal. I don't say that to recommend that people gather in groups in your homes to celebrate the holidays or Christmas or anything else. I say that recognizing that some people are still going to do it. So as all of our medical professionals have said, I would hate to be the person or the event that caused one of my loved ones to contract coronavirus and, God forbid, to pass away from coronavirus. And everybody knows, at this point, everybody knows somebody who's gotten coronavirus. Probably everybody knows somebody that's gone to the hospital. And many of us, unfortunately, have family members that have died from coronavirus. I have one. I have a friend that's in the hospital on a ventilator right now. Not in Lubbock where the other one passed away, but so we all have these stories that we can tell, and we want to do what we can to not host the event that caused a loved one to contract coronavirus and possibly die. So we're just asking people to be responsible. If it's possible to cancel your event, to have a virtual event, or to do something that is ultimately going to prevent the spread of coronavirus to those people, then do it. If you don't have the ability to do that or don't have the willingness to do that, then take all of the necessary precautions to have a safe event. Again, I don't say that to recommend that people have that event. I say it in recognition that some people will, and I want them to be safe.
Absolutely. That's all I have, Dave. Thank you, guys.
Thank you, David. That concludes our news conference for today. This is David Henry. I'm the Communications Manager for the City of Amarillo. Once again, we do these every Wednesday at 11 a.m. for the latest in COVID-19 information for the Amarillo community. I want to thank all of our panel members who took the time out